The second expert for tonight is Gaurav Kant. He's senior embryologist in Akanksha IVF, and he's co-convener of SIG Embryology and convener of SIG Andrology, and first Indian embryologist to be certified by both ESHRE and ASRM. And we all know Gaurav. Gaurav, welcome. And today's interesting debate is on time lapse in IVF. And our first speaker will be Dr. Snigdha Soni. Dr. Snigdha, if you could. She is a DM reproductive medicine resident in AIMS New Delhi, and she's done her MD Obs in Gynae also from AIMS New Delhi. Thank you, Dr. Snigdha. You can carry on with the debate. She'll be speaking for the motion.
Thank you, ma'am. Good evening, everyone. I'm Dr. Snigdha. I'm currently pursuing DM in reproductive medicine. And the topic today, as we all know, is the role of time lapse in IVF. And I would be speaking for its use. As we all know, the time lapse system includes an incubator with an integrated microscope and cameras, which are then connected to an external computer. And there is a use of a digital camera which can capture the images of embryos at various time intervals. And this can then subsequently be played back as a time lapse sequence. So, this allows us to observe the embryo development and also evaluate the timing of various events that have taken place throughout that process. And currently, we have various time lapse systems that are available in the market, which use different technologies, which could be bright field vision, dark field vision, and have various other features. The process has gone on. It was initially developed in 1997, where just the intermittent observation of the fertilization was taking place, and from there on, it has progressed to include observation of various events that happen during the embryonic development and fertilization. And currently, it has progressed now to prediction of pregnancies and live births, and predict which embryos would be fit for implantation, and also predict the ploidy status. Coming to the various advantages, for which time lapse system has been used. So, it is currently being put to solve the various observational dilemmas that we come across while selecting the embryos for transfer. Because of the presence of continuous observations, it also ends up providing more information regarding the embryos. And time lapse system provides an undisturbed culture environment for the embryos. So, and also there is a standardized embryo evaluation that takes place because of the morphokinetic features which are being evaluated in this. So, ultimately, this leads to improved outcomes and a reduced time to pregnancy. Apart from these clinical advantages, there are other advantages associated with it as well. It is a tool for quality control, assurance, and management, and provides a lot of flexibility in the workflow for the lab personnel. And time lapse system can be a tool for education and training of the various persons in the lab, and as a tool for research, and also provides a facility for remote monitoring. So this is some additional benefits that it provides. Now let's see how each of these help us and how we progress from there. So there are various factors which are responsible for successful outcome in the IVF cycle. One of these includes an optimal incubation environment and also accurate embryo selection. So the incubation environment is influenced by a lot of factors, including the environment with the oxygen concentration, the temperature, the pH. Then, apart from that, the patient factors, which include the age, the etiology of infertility, the stimulation protocols, and apart from that, the embryo factors such as the aneuploidy and the progress. So, all of these come together and ultimately result in a successful pregnancy. And time lapse has a lot of role in influencing, in providing an optimal environment, and also helping with the embryo selection so as to so that we have a viable embryo for transfer. So, first thing that we need to see is that whether any new technology that is being put to use is how is it featuring in terms of safety. So, initial concerns were raised in terms of the light exposure to the embryos. However, all the the current time-lapse systems in place avoid use of short wavelengths, which are potentially detrimental to embryo development. And so the overall light exposure, which is it turns out is much lower than what is there with the standard observation, as the embryos are removed from the incubator each time when they have to be evaluated and are exposed to the light in the laboratory. We can see that the total dose ultimately is much lesser in the time lapse system as compared to the conventional incubator and under conventional observation. So this and also then coming to this, the concern that we have with the conventional method of evaluating embryos and for incubation is that the less amount of disturbance we cause to the embryos, the less stress it brings to the embryologist and to the doctors. Because each time that we disturb the embryo from the or we remove the embryo from the incubator, we're concerned about the exposure to the environment and the potential harm that it can bring. However, the benefit that more number of observations give us in terms of better selection of the embryos and evaluation of various features in terms of the progress of division and various morphological features of the embryos. So so during a conventional evaluation or in under the standard benchtop incubators, we have to balance both of these to achieve an optimal outcome. However, with the use of a time lapse technology, what we have is a continuous observation and which happens in an undisturbed culture with strict environment control. So, giving us the best of both. So, how is an undisturbed culture beneficial? So, and why exposure to the environment can produce problems because of the changes in the concentration of the oxygen, changes in the osmolality. There can be pH fluctuations as well as temperature fluctuations. So, an undisturbed culture provides a better environment in terms of a more stable environment for the embryo culture, and by avoiding all of these. And this was a study that was a randomized control trial, which also suggested that with the use of an uninterrupted culture in time lapse imaging, higher quality embryos were produced on day three onwards as compared to standard incubation. So the earlier part of the embryo development up to day three is maybe not under that much influence of these factors. However, between the day three and then up to the blastocyst stage, there's a significant influence. And also, higher implantation rates were noted for time lapse imaging, suggesting that it would contribute to selection of better quality of embryos. These are various studies which have evaluated conventional incubation as compared to the time lapse imaging with various outcomes, which would include the blastocyst rate, the usable blastocyst, top quality blastocyst, etc. However, a majority of these studies show that an uninterrupted culture has a better outcome as compared to where a conventional or conventional culture systems. Then, embryo selection, as we know, has been traditionally done by the morphological system using a tiered grading system. And the evaluation is done at static time points. This is subjective in nature and also can have a lot of inter-observer variation. And also, it is limited to just brief assessment at specific time points once a day because of the harmful exposure outside the incubator. So the morphological grading predicts the developmental competence in implantation and includes various parameters, including the morphology of pronuclei, the state-specific cell numbers, fragmentation, as well as the grading of the blastocyst. However, as we discussed, it is just a snapshot of the embryo development and not the continuous process. And the status can change markedly even within a few hours. And this requires physical removal from the incubator, exposing them to the fluctuations in the environment and the intra and inter-observer variability. So with the use of the time-lapse imaging, we have more embryo information in terms of dynamic morphology, that is continuously changing morphology can be evaluated in terms of identifying various cleavage patterns and in terms of morphokinetics. So when we come to the dynamic morphology, so at the pronuclei stage, it can be helpful in identifying transient pronuclei, and sometimes it can avoid discarding diploid zygotes who have undergone early PN disappearance or a fusion to form one PN, which are actually zygotes with two pronuclei. And also it monitors the position of the pronuclei in the cytoplasm, which is an important marker for aneuploidy. When it comes to the cleavage stage embryo, it is important to evaluate for the multinucleation, the degree of fragmentation, and the irregular cleavage patterns. So, the dynamic changes occur mainly around the cleavage events, and if missed, can potentially lead to wrong grading and embryo selection. So, multinucleation is also a potential marker of aneuploidy and implantation, and it can only be visible at a certain time point. And it has been seen that standard observation can overlook almost 23 to 70% of multinucleated embryos. As we discussed, about 20% embryos divide incorrectly or can have abnormal cleavage patterns as well. And these embryos have decreased implantation potential. So, there were some patterns which were identified only on the basis of time lapse imaging. And some of these include the direct cleavage, which includes a direct division from a one cell to a three cell stage or from a two cell to a five cell stage. And because of standard observation, a large majority of these are missed. However, the studies have shown a significantly reduced clinical pregnancy rates and high incidence of chromosomal abnormalities in embryos who display such a cleavage potential. Apart from this, time lapse is also useful for identifying embryos which have undergone a reverse cleavage. This is occurred in almost 25 to 30% of the embryos, and these embryos show a significantly reduced implantation potential. These are various atypical features which are observed using the time-lapse technology as compared to the classic morphology assessment. And discussed abnormal syngamy, the variations in the pronuclei, abnormal cleavage, then multinucleation, the movement of the blastomeres, early compaction, and collapse of the blastocyst. So all of these are important parameters for predicting the embryo implantation as well as the outcomes. As we saw that time lapse could be used to identify uh, provide a method for embryo selection as well, and this is done with the with morphokinetics, which involves a combination of the embryo appearance, that is the morphology, and the timing at which these cellular events occur. As we can see that various time periods and the times at which each event takes place are identified in terms of the cleavage states, and any abnormality in these can be used to predict various outcomes. In when we carry out the embryo evaluation in the time lapse system, we have the workstation where the annotation of the embryos in terms of the morphology, in terms of these timings can be carried out, and it could be a guided annotation wherein it is done by the embryologist, or even as we progress towards the AI, wherein the system itself gives the score and identifies the various embryos. What are the impact of these morphokinetics on various clinical outcomes? So, can it predict blastocyst formation? So, is there a way to identify certain day 3 embryos which would likely progress to have a higher chance of progressing to a blastocyst? As transferring a blastocyst ultimately results in higher pregnancy rates, but also sometimes the prolonged length duration of embryo culture may also have its harmful effects. So, if is it a possibility that we can identify an embryo on day 3 which is likely to progress to day 5 and would give better outcomes? Do they predict implantation or live birth so as to improve outcomes with an elective single embryo transfer? And do they predict ploidy status in the embryos? The various studies were done. This was in 2011 by Messager et al., where the use of morphokinetics as a predictor of embryo implantation was evaluated. And they identified that timing of cleavage to five cells had the best correlation with the implantation success. And based on various parameters, they gave a algorithm to identify categorize the embryos in different groups, and also gave a criteria for deselection of the embryos. So initially they could be discarded by the morphological screenings, or if not, then could be deselected with the exclusion criteria, which included an uneven blastomere size at the two cell stage, any abrupt division or multinucleation, and then were classified on the basis of various timings at various division stages. So based on this algorithm, Ruby et al. Carried out this study to validate this algorithm in terms of the pregnancy outcomes in a randomized trial. And they saw that the ongoing pregnancy rates were higher in the time lapse group as compared to the control group, with 51% in this and as compared to 41 in the control group. The ongoing pregnancy rates were also higher, and the time lapse group had lower incidence of pregnancy losses as compared to the controls. So this validated the algorithm that was proposed by the group. So this was a meta-analysis which included 5 studies with 1,637 patients, which was published in 2017, which evaluated and showed that the clinical pregnancy and the ongoing pregnancies were higher in the time lapse group as compared to the controls, and the live birth rate was also higher, and they had a lower incidence of pregnancy losses. So, based on this, the KIT score or the known implantation data score model was proposed, which included KIT score on the day 3 and the day 5. And they had data from multiple day 3 and day 5 transfers and were used to select embryos for transfer. The day 3 score was used to select a day 3 embryo for transfer or to decide for further culture to the blastocyst stage. And it had some specific parameters which had to be annotated in the embryoscope and had scores ranging from 1 to 5. Subsequently, Kids Code Day 5 was developed and was used on day 5 embryos to prioritize an embryo for a transfer or freezing. And the scores range from 1 to 9.9. So we can see that this score was defined that the range of a morphokinetic variable was identified, which was applicable in majority of the patients, and any time period outside of that range was suggestive of a low implantation potential. And based on that, various groups were identified. So, this study evaluated the kit score on day 5 for the prediction of pregnancy potential in fresh as well as frozen embryo transfers. And there was a significant correlation between the kit score and the pregnancy rates for the fresh as well as for the frozen transfers. And when evaluated, there was the area under curve predicting the pregnancy outcomes between the kit score and the morphology evaluation of the embryos showed that the kit score was significantly better in terms of predicting the implantation rate for fresh transfers as well as the implantation rate and the viable pregnancy rates for the frozen transfers. So therefore, the clinical relevance of using a time lapse technology was identified based on this. Then apart from that, it is also the very studies have shown that as the embryo evaluation on day 3 can also be used to predict blastocyst formation in these patients, and there's a multiple parameters associated which can significantly predict that. Then this recent study in 2024 evaluated the morphokinetic parameters which would affect outcomes in the PGT cycle and its correlation with the euploidy. So it showed that there were various parameters which correlated with the blastocyst quality and the chromosomal status, and embryos which had rapid division had tended to exhibit better quality and had higher chances of being euploid. And the late morphokinetic parameter, that is S3, had a significant effect, predictive effect on the quality and the chromosomal status. So there is a role on which needs to be further seen regarding the predictive ability of the time-lapse technology on the euploidy status of the embryos. So there has been a gradual assessment evolution in the embryo assessment, with initial manual assessment based on the morphology, followed by the manual assessment of the morphokinetic parameters, then a guided assessment wherein it was algorithm dependent. However, input from the embryologist was required, and followed by now a AI-based automatic assessment. And the time-lapse technology helps in all of these. So the IDA score is a AI-based scoring system, and which works on the fully automated analysis of the time-lapse sequences and gives an objective ranking based on the likelihood of implantation of each of the patient's embryos. So the time-lapse sequences are generated by the embryoscope, and the IDAS algorithm generates a score which correlates with the likelihood of implantation. And the final decision can be made dependent on the various parameters, whether to transfer the embryo or not. So this is a consistent, objective, and automated and a reliable method which can be used to select an embryo for transfer. Now, the time lapse also has certain other benefits which go beyond the embryo selection. These include workflow improvement, as there is flexibility in the timings along with the standardization of the measurements, and it also provides an opportunity for remote access to monitor the embryos. Then there is improved communication, so there can be improved communication within the lab, can be used to have a second opinion from another embryologist, or for education and training as well. Then improve communication between the lab and the physician to document the various embryo qualities, to come up with a detailed plan, and also between the physician and the patient to counsel, because an image speaks a lot more than any words, and can be an effective tool to counsel the patients as well. And also there's a lot of it contributes to risk reduction in terms of lesser exposure to the environment, continuous access to the incubator conditions, and also can be used for quality control. So to conclude, uh, if we have to see whether there is any merit in this technology, so there is robust evidence for the physiological basis in terms of the uninterrupted culture and the benefit that that provides, and also in terms of the dynamic observation and the various features like the abnormal cleavage patterns that could be identified because of this. Time lapse does provide us important information in terms of the embryo development, which was not available, which was not known with the single point assessment, and also it has been shown that there's an impact of these kinetic markers on the embryo competence, and also it is useful for both the lab personnel as well as the patients. So it can be an important tool for embryo deselection, and also now because of the continuum of information that it provides, used for development of AI algorithms and also further advances in this field for embryo selection. And in terms of cost effectiveness, to introduce any technology, the initial cost may be high. However, if there is improvement in the embryo selection and in reduction in the time to pregnancy, and also improvement in the efficiency of the lab personnel in terms of the flexibility in the embryo assessment, which might lead to reduction in the staff, or the timing can be varied, or in terms of even training and communication. So in that scenario, it is a cost effective approach which can be applied dependent on the individual scenario. So coming to that, so these are the various features that it provides, and it is based on this, it could be justified to use time lapse technology. Thank you. So, as we know that there's been a search for objective markers of viability, though currently to date none of these have been appropriately identified, and the story does not truly end here, and even the time lapse would go on from here. But till now, these are the benefits. This is the evolution that it has brought, and these are the benefits that it provides. Thank you.
Thank you, Dr. Snigdha. So now let's hear about from Sita what she says about the time lapse. Yeah, welcome, Dr. Sita.
Hi, ma'am. Can you see my screen?
Yeah.
Yeah.
So Dr. Sita, she is a clinical director.
Of,
She is DNB, FNB, MRCOG, 10 years of experience, All India ranker, alumni of AIMS Delhi, published several research papers. So welcome, Dr. Sita.
thank you, ma'am. So
So
today,
let's listen what you say about the time lapse.
yes, ma'am. So the goal of this discussion is to know whether there is enough evidence and to see the arguments which question the effectiveness and cost efficiency of time lapse in IVF. So, time lapse is continuous monitoring of embryo development using specialized incubators with built in cameras. The promised benefits of time lapse are improved embryo selection, less handling and disturbance, and enhanced developmental insights. Uh, but actually, the reality is the following are the main disadvantages of time lapse, that is inability to view embryos in multiple planes. So actually time lapse systems provide a two-dimensional view of embryo development, which can limit the ability to assess all aspects of the embryo structure and activity. And time lapse involves high cost. So if time lapse is involved, there is a minimum cost addition of 35,000 to 50,000 for a patient going for IVF, and these are expensive to purchase and maintain, potentially increasing the overall cost of IVF treatment for patients. And there is exposure to electromagnetic effects and fumes. So time lapse system may involve these exposure to these fumes from lubricants, which could potentially affect the embryo development. And there is no conclusive evidence of increased pregnancy rates while using time lapse. So some studies suggest that this is better, but there are many studies which suggest that time lapse doesn't improve the pregnancy outcomes. And there is a need for specialized training to use these time lapse equipment. So operating and interpreting time lapse data also requires specific training for embryologists, which can be barrier to implementation in many clinics. And there is limited visual observation. Time-lapse systems may not allow for the same level of visual observation as conventional microscopy, especially when embryos have high fragmentation or overlapping blastomeres. And there are algorithm limitations also. So, while some algorithms aim to improve embryo selection based on time lapse data, their effectiveness is not always proven. And some studies suggest that time lapse based embryo selection models may sometimes reject embryos that would have otherwise led to successful pregnancies. So, there can be a rejection of normal viable embryos also. So I'll start with the results mainly, because finally ultimately it comes down to the result. So recently there are many RCTs which have been published which show which about the clinical effectiveness and safety of time lapse imaging. So this is a tilt trial. This is a multicentric three parallel group double blind randomized control trial which included 1575 participants. So this study suggests that the use of time lapse imaging systems for embryo culture and selection does not significantly increase the odds of live birth compared with standard care without time lapse imaging. This was published in Lancet 2024. So there was another study published in Lancet 2023. This is the Selectimo trial. This is a three-armed multicentric double-blind randomized control trial which included 1,731 couples between 2017 and 2020. So here, this study also concludes that neither time-lapse based embryo selection using the EVA test nor uninterrupted culture conditions in a time-lapse incubator improved clinical outcomes compared with routine methods. So, widespread application of time-lapse monitoring for fertility treatments with the promise of improved results should be questioned. So, even this study says that the pregnancy rates are not significantly improved with using time-lapse. And there was these are the RCTs which are published in the latest editions. And then there was a meta-analysis which was published in October 2023. So this meta-analysis involved 14 randomized control trials, and they have involved both based on morphology in TLM incubators increase the risk implantation rate compared to conventional incubators, but low to moderate quality evidence suggests that the incubators did not improve live birth rate, ongoing pregnancy rate, clinical pregnancy rate, and miscarriage rate compared to conventional incubators. So they even said that time lapse based embryo selection also did not improve the live birth rate, ongoing pregnancy rate, clinical pregnancy rate, implantation rate, or miscarriage rate compared to the conventional method based on morphology. So this meta-analysis suggests that time lapse is still an investigational procedure for IVF ICSI practice. Then there was another meta-analysis published in 2017. This is slightly older, but this meta-analysis also involved 10 RCTs. Four involved oocytes, and six studies involved women. I mean, they randomized women. So they also concluded that there is insufficient evidence to support that time-lapse imaging is superior to conventional methods for human embryo incubation and selection. So, in consideration of the limitations and flaws of included studies, we need more RCTs to go evaluate the effectiveness of time lapse imaging. So, then this was uh, this was this is a randomized control trial which also said that there is no significant difference in live birth rate for single embryo transfer cycles or double embryo transfer cycles, and there are the pregnancy rates, clinical pregnancy rates, and cumulative pregnancy rates were similar between time lapse system or the normal normal conventional systems. So this study also concludes that the two components of the TLI system, undisturbed culturing and morphokinetic embryo grading, do not appear to have a significant additional value in reproductive outcome, although these results should be validated by future RCTs. So this is also a systematic review in 2018, which also suggested this review included 13 studies, and they also suggested that this is mainly for embryo ploidy. So there are some school of thoughts where they told that time lapse imaging can be comparable to PGT, but this study shows that the PGT is much better than time lapse in predicting embryo ploidies. So there was a Cochrane review also in 2018, which has compared time lapse versus the conventional incubation and assessments. So they included 9 RCTs, and when they compared time lapse system with conventional morphological assessment of still time lapse system images versus conventional incubation and assessment, they said it is unclear whether there is any difference in live birth rate or ongoing pregnancy rate or in miscarriage rate. And it is unclear whether there is a difference between the interventions and rates of stillbirth or clinical pregnancy rates. And when they compared TLS using embryo selection software versus TLS with conventional morphological assessment of still TLS images, then also they were uncertain about the results, whether TLS can improve or not, because of the very low quality of the evidence. And there was only one RCT which reported ongoing pregnancy, and it is unclear whether there is any difference between the interventions and rates of ongoing pregnancy, miscarriage, or clinical pregnancy. So then they even commented on TLS using embryo selection software versus conventional incubation and assessment. And this was also, they were very uncertain due to very low quality of evidence. It is unclear whether there is any difference between the interventions and rates of live birth. And there was very low quality evidence that it might reduce miscarriage, but it was a very low quality evidence. And it is unclear whether there is any difference between the interventions and rates of clinical pregnancy. So the authors have concluded that there is insufficient good quality evidence of differences in live birth or ongoing pregnancy, miscarriage and stillbirth or clinical pregnancy to choose a time lapse with or without embryo selection software and conventional incubation. So as the evidence is very low, the findings should be interpreted with caution. So coming to the conclusion of all the studies which have been done in the recent mostly 10 years, I have included. So the key trials are the Selectimo trial in 2023 and TIL trial in 2024. Both of them, they have said that there is no significant difference in pregnancy rates and live birth rates. And the systematic review, the latest is 2023, they said that there is no significant improvements in live birth, pregnancy or miscarriage rates. And Cochrane is actually 2018. They said there's insufficient evidence of benefit. And these are the other. This is just a comprehensive summary of all the studies. So as we have discussed, the Selectimo trial. It was a multicentric randomized control trial which said that time lapse system does not improve the ongoing pregnancy rates. Same the TIL trial, they said the time lapse system did not improve live birth rates compared to standard methods. And the systematic review also said that time lapse didn't improve live birth rates, ongoing pregnancy rates, clinical pregnancy rates, or miscarriage rates. And the Cochrane review also said that there is insufficient evidence to say that time lapse improved the clinical pregnancy or ongoing pregnancy rates. And the UK's Human Fertilization and Embryology Authority reviewed multiple studies and concluded that time lapse imaging does not improve the chances of having a baby for most patients undergoing IVF. And a study done by Amsterdam UMC, they also have found that it did not improve pregnancy rates within 1 year compared to conventional methods. And the study also questioned the cost effectiveness of time lapse monitoring. And in the University of Liverpool research, they have also found no evidence that time lapse imaging improves the chance of successful pregnancies. And further research is actually needed. So, coming to the summary, time lapse imaging in IVF offers promise but also has drawbacks. There is no clear consensus on clinical efficacy. Ethical, financial, and technological limitations must be considered, and further research and regulation are essential.
Thank you, Dr. Sita. So it
Yeah.
was an excellent present by both of Dr. Snigdha and Sita. So Snigdha, you have to say anything in rebuttal? You want to say anything now?
No, I think we just mentioned all the points and whatever was there with that.
Yeah, so we have expert with us, Dr. Yogesh and Gaurav. So first, Dr. Yogesh, you want to say anything? What's your views about both of them?
Dr. Sita, Dr. Snigdha, you presented very well. But what was missing? What was missing is there are guidelines provided by the ASHA latest in 2023. That guidelines based on the uses of 42 add-ons, and this is one more add-on because low low quality evidences. The problem with this time lapse is the evidences are low. low quality evidence. We cannot rely upon. Majorly, all these data are data that includes lesser number of the individuals. So this research is open, but ASHRAE guidelines 2023 document is also saying it is not recommended. But but this time lapse actually did not contribute in terms of the pregnancy rate, the implantation rate, the successful rate, or the selection rate. But something is very good with this time lapse is some insightful, some insightful studies were came across that, like, we can find out that earlier in our textbook only we had that a picture when sperm is attached and head is going into and it is fertilized. No, whole sperm is injected, whole sperm is going into the is fused with the ooplasm. So this is something that insightful outcome that is came out as a result of using time lapse. Also, there are the monozygotic twinning where we can find out that the ICM sometimes is stretching into two different poles, and we can find out also and some abnormality. And we found that some of the embryos, those are leaving some bad cells, those are pushing some the fragments, and the base the pattern which one embryo is following, that holoblastic equatorial cleavage patterns. Those are some insightful outcome that we came to know as a result of using this time lapse. But as Dr. Sridhar says, it is cost effective. No, it is not cost effective. Number three, when we're talking about the utilization, we can use, no problem at all. If the evidences are saying that we cannot, this is against the application of the time lapse, but we can use it. But for that sake, we should not take any additional charge from the patients. So this is from my side to you, everyone. And here, both of you must go to the guidelines. The guidelines are there on a specific intervals, frequencies. We are having guidelines from ASRM, ASHRAE. So we must include whenever we are preparing our presentations, our PPTs. We should include these guidelines also. This is a small suggestion from my side. Rest presentation is very well from both the participants, both the presenters, and I hope next time we will include all these points also. Thank you so much.
Thank you, Dr. Yogesh, for summarizing it and explaining everything, especially this ISRAE guideline. So now, Gaurav, Dr. Gaurav, you want to say anything?
Yeah, hi. Good
Yeah.
evening.
Yeah.
First of all, apologies, I'm driving right now. Just give me a second. Congratulations to both of you for the wonderful presentation that you both have given. One has given the basic idea of the principle of the science of time lapse. And the second, Dr. Sita, I'm quite impressed with you that the way she has presented all the meta-analysis and RCTs available. That time lapse is not that useful right now. What I always saying about time lapse is it's like a bag, like a Louis Vuitton bag, but the basic purpose of the bag is to carry things. So it's on you whether you want to have a Louis Vuitton bag or a normal bag in your lab. Initially, we started with the morphokinetics, but later on, using the morphological assessment is shown to have the equal assessment and the results. Right. We came to the deselection also. There you talk about the deselection, about the 1 to 3 cells and the reunion of the cells from 2 cells to 1 cell, they go back. But the incidences are quite less into this. Around 3% incidences are there. So whenever we are putting an embryo selected by the time lapse versus selecting morphologically, we are putting the good blastocysts. That's why the results are almost same. But where we are banking upon right now is the future. You have recently must have heard about the robotic ICSI, where the ICSI was happening inside somewhere and somebody else was controlling it from the New York. Probably in the future, time-lapse incubator with AI will have the power to do the ICSI, to control the culture systems and to produce the embryos where you can have a machine like Daisy, where you have a live on spot spectroscopic analysis of the metabolites. So without even touching the oocyte, you will have the blastocyst where you have the complete analysis of everything. But yes, it's a tool that you are just keeping with you for the future. Right now, it is as equal to the morphological assessments. Thank you.
Thank you very
Gaurav,
much.
I have one question. Gaurav, I have one question from you because
Yeah,
I
Dr.
need to
Yogesh,
ask
please.
you. So this is something very crucial in terms of our learning as far as this basic science is concerned. We need to stick to the basics first. And my question is, latest just few months back, 8 months or 9 months back, at that time I was teaching my student and I was saying that all 3p and 4p should be discarded. But this time lapse find out what 3p and 4p they are having the capability of developing into the blastocyst, and not only the blastocyst but the euploid blastocyst. Those were tested by PGT.
Right.
So how this deselection of the embryo, you talk about the deselection. So how this time lapse is able to deselect when we are having this 3p and 4p also having the development potential to the euploid embryos? How can we deselect? How can you justify your statement of the deselection? And this is for insightful question for you, this presenter, and the participants also. So please throw some light on this aspect.
Okay, I talked about the deselection on the basis of one cell divided into three cells, and sometimes two cells merging into a one cell,
Fine,
right?
that's fine. I'm talking
And
about no. Fine. I'm
Yogesh,
talking
Dr.
about
Yogesh,
3pn. Just a moment. 3pn, 4pn, euploid embryo tested by PGT. Euploid. How? How
Dr.
this
Yogesh,
embryo?
Dr. Yogesh, I want to know you are right. That is called as chromosomal segregation of the blastocyst. So what happens is when a 3p and a 4p are there, the chromosome correct itself to become a euploid. But how many of them we are going to check on the genetic analysis and put back in the uterus? How many of us are ready for it right now? That is why this tool was developed for deselection. This is what I'm saying. We're not going to check all the embryos for euploidy. And when you are saying this, that the 4pn goes euploid, but the incidence of getting euploid with those kind of embryos or the PNs is very less. Not
Yeah,
all goes
that's
to
the point.
euploidy.
Yeah.
The point is that, see, we all are banking upon why we have the criteria of morphological selection, because we all are banking about the 2pn, two polar body, correct division of 2 cell, correct division of 4 cell, then the 8 cell. We go back to the Y mu annotations. He was the first person to put the inverted microscope into a
Gaurav, that's
plastic
fine.
jar, put the camera there, and
Gaurav, that's
put all
fine.
the
That's
annotations
fine.
there.
That's fine. I am asking. I am
Okay,
asking that
I
ASRE
think we should
guidelines.
not have the we
Just a
should not have
moment.
the argument
ASRE
between us.
guidelines
It is
also saying no. ASRE guidelines also saying when you are performing PGTA, that is also not recommended. So where I am actually.
Yeah. So thank you very much. Thank you, Gaurav and Dr.
thank you so
Yogesh,
much.
for explaining everything very well. And
Thank you, madam.
congratulations
Thank you
to
so much.
both. Yeah, thank you for joining and sparing your time. And congratulations to both the participants. They have done very nicely
Excellent,
on their
excellent
parts,
presentation.
Snigdha as well as Sita both.
Thank
So very well
you.
explained by Snigdha that time-lapse imaging is an important tool for embryo deselection and flexibility of the working in the lab. But definitely it's not cost effective. That's why Ashray also has told that it's not recommended for the time lapse. So thank you very much. This YET program we are doing every second and fourth Friday. This project is for inspiring the youth, young IFS talent. Anyone who is interested to do in the reproductive endocrinology, endoscopic embryology, please let us know in the group or personal message. They can be involved. Less than 45 years, everyone. But yes, this program, anyone can listen anyone of any age. So your friends, you are still not joined the group, you can share the link and make them join. We are having debate session also. You can project, we discuss guidelines also, and you can project your any journal, any topic. So thank you very much. Thank you, Dr. Yogesh, Dr. Gaurav, and both the
Thank
participants.
you
They've
so
done
much,
a
ma'am. Thank
wonderful
you so
job.
much. And it's very good
Thank
to
you.
learn.
Thank you so
Thank you
much.
so much, madam.
To learn.
Thank you, Dr. Sita. Bye-bye.
Thank you.
Yeah.
Thank
Thank you. Thank you.
Okay, bye.